I've been a therapist for 31 years, and I just decided that I wanted to go out on my own because I had sort of a specific vision for how I thought therapy ought to be conducted, and I'd worked in a lot of great places, but I really wanted to just bring it to the next level, a little more of a specialized kind of clinic where the patient really felt they were heard, that we looked at the person as a whole. Which is not necessarily a new concept, but that's fairly unusual for physical therapy. And we are used to getting really good results. And I think it's because we do look at, what is the patient concerned about? What are some other things that might be contributing to it? So, and I really have a passion for teaching both patients and other clinicians. So I thought it would give me a chance to impact both the patients and sort of grow up the next generation of the therapist. So we have two options. We practice in Thomasville, that's where our main office is, and then we also practice in Cairo. Thrive Physical Therapy is a clinic that provides general therapy as well as a lot of specialized things, and that's what Dr. Kendra tends to use us a lot for. We have a lot of extra training as therapists in our clinic for weight loss and fitness. So for patients that are potentially trying to lose weight or potentially considering having weight loss surgery, we're uniquely equipped to help them with that process. Not to knock personal trainers, but that's sort of a weekend course. We all have doctorates of physical therapy. One of my therapists has a degree in kinesiology and sports nutrition. So we have a lot of extra training to make sure that those people that have health risk. One of the reasons that we feel like it's a great teamwork to work with Dr. Lynch and her team is that Dr. Lynch and I really come from the same perspective as far as how patient care should happen. It's interesting, I met her outside of a working relationship, and we instantly started talking about sort of our philosophy of treatment and how we viewed patients and how we viewed life in general. I think we both feel like what we do is a calling. I think we both feel like that the body is very resilient, and that if you teach patients the right thing to do, that their body can recover, and that they can get to a better state of health and fitness and capability. And so she and I are definitely on the same page as far as that. I think both of us realize that the body and the mind come as a unit, and we try to use both of those tools to help us to get the patient to what their goal is. And usually, that's sometimes it's specific weight loss goal, sometimes it's that they want to reduce pain, sometimes they're trying to reduce heart disease or the risk of stroke or diabetes. But we understand that there's habits that have to change in order for that to happen, that the person has to sort of be in the right state of mind, and that we have to provide the right the right framework for them to get to that next step. And it is a process, and luckily she and I recognize that, and I think patients really respect that from us, in that a lot of times patients say, "Oh, you're so patient with me," but by the same time I set a pretty high bar. So it's a good balance I think you have to have as a clinician, and I think both Dr. Kendra and I come from the same perspective with that, and I think the members on her team, we recognize that you really have to be there to support the patient, and you really have to know your medicine to do that.